Who here, by show of hands, knows how to provide CPR on someone? All right. For those of you who don't, hopefully by the time I'm done, you guys will be able to feel a little bit comfortable and know how to go over the steps on CPR. So first and foremost, we're going to go over how to address the situation and how to react to a situation properly. After that, I'm going to have to talk to you guys about how to prepare, and finally how to execute the situation on proper CPR. So I'm a lifeguard. I'm certified in CPR, AED, oxygen, everything, first aid, all you need to do, everything you need to provide care for regardless of what the situation is. So the first thing you guys are going to want to do, if you guys see an unconscious victim, you're going to come up to the person, tap and shout, say, "Hey, are you okay?" Try to determine whether or not, they're unconscious or conscious. And right away, if they don't react, they're unconscious, if there's anyone around, you're gonna automatically tell them to go call 911. You're gonna want EMT and further medical or advanced medical treatment, then you're gonna need them to help you out. But while they're calling 911, what you guys are gonna do are gonna check the ABCs. That's airway, breathing, and circulation. So by that, normally they're going to be on the ground, but so you guys can see properly, I'm going to show you guys how to, so get on the table. So first thing you're going to do is check the airway. You're going to open up the victim's airway by tilting the person's head back, and you're going to put your ear down over to his mouth and open up the mouth and make sure and look, and you're going to check to see for circulation and see if the chest is rising, and you're going to listen for breathing, and just look, listen, and feel for no longer than 10 seconds. So you're going to put your head and your ear to the victim's mouth and look for the chest to rise for no longer than 10 seconds. If you don't see the chest rise, you can retilt and try again. Maybe you didn't open up the airway enough, and you're going to do that again. If you do that twice and the victim's chest isn't rising, you're going to provide 2 rescue breaths. And when you give 2 rescue breaths, you're going to tilt the victim's head back and give 2 rescue breaths. You're going to close the victim's airway. For lifeguards, we're provided with rescue masks and gloves for protective barriers, but most people don't have that, so I'm just going to show you guys how to do it without that. So you're going to plug the person's nose with both fingers. You're going to open up the airway and give 2 breaths. You don't want to give them too long, so you don't, you're going to just 2 regular breaths, not too short, but in between long and short, medium, whatever. And you're going to give 2 rescue breaths. And you're going to look for the victim's chest to rise. And if that chest does not rise, you are going to retilt and try again, because you gotta make sure those 2 breaths go in. So you give 2 breaths, regular breaths, the chest rises. Now what you're gonna do is on the side closest to you, on the neck, you're gonna check for a pulse to see if they have a pulse. And you're gonna feel on the neck, it's called the brachial artery, I believe. And you're gonna feel that for about no longer than 10 seconds. If you don't feel any pulse, you are going to start CPR. And what you're gonna do, and when you give CPR, you're gonna start by locking your right hand on top of your left, or vice versa, whatever you feel most comfortable with. You're gonna lock it like this, put your fingers through, and you're gonna place it in between, on the chest, in between both nipples. And you're gonna give 30 compressions to every 2 breaths. And when you give your compressions, mind you, CPR is not a very nice thing. because when you give CPR, you're going to have to compress the chest, most likely break some ribs. So on this dummy that we have for my work, you're going to practice, and when you hear that pop, that's the proper compression you're going to have when you give CPR. So you're going to do 30 chest compressions to every 2 breaths, and at a rate of pretty much 1 and 2 and 3. I'll show you guys real quick. And you're going to do that till you reach 30, and then after you're done with that, you're going to give 2 breaths. And you're going to do that until either EMT comes, you have another person or a lifeguard or someone who is certified in CPR or knows how to do CPR to come help. And then the ratios changed a little bit. So the ratios for CPR, for one person providing CPR, no matter if it's an adult, child, or an infant, it's going to be 30 chest compressions to 2 breaths. If you have 2-man CPR, for a child and infant, it's 15 to 2. So hopefully I'll show you guys. If you guys are ever able to get protective barriers, use them. This is a pocket mask that we use that goes over the victim's face to pop it out and use it, and it gives better breath. And you can, these are just protective barriers to stop from bloodborne exposures, or if the person's sick, you don't want any of that. But then again, you gotta do what you gotta do in case of a situation. So hopefully those are just the basics on CPR. Hopefully by this demonstration you guys know some of the basics and know what to do in case of an emergency. Thanks.